Okay. Hi, everybody. I'm Changrong Yuan, professor of nursing school, Fudan University. Thank you so very much for having me here today to share our research related to nursing science and rehabilitation service in China internet area. I've learned a lot from previous the keynote speaker. So from what they said, we already know what kind of problem we are facing. So now, because we have more and more patients with chronic disease and rehabilitation and health management are very important issues for them. So how to satisfy those demand during this very special time? I mean, especially facing for the pandemic issues or patient is not. I mean, it's not convenient for patient with chronic disease to go to hospital easily. Current system of rehabilitation in China, I think we still have room to improve. So we facing some problems such as shortage and uneven distribution of medical resource, lack of quality standards, lack in equipment and facilities, and the difficulty of interagency information sharing. So in order to improve our service quality, in recent years, government issues a lot of policies to support Internet plus rehabilitation and Internet plus nursing services. That's a very good time to do the practical model reform. So to my understanding so far, there are 3 patterns of internet rehabilitation in China. Part 1, regional network pattern, which is usually initiated by a regional government, local government to establish a network of rehabilitation services. And second one, hospital-centered pattern, which refers to a network of rehabilitation services with a large official general hospital as its core and some other rehabilitation institutions of lower levels as the subordinate institutions like hospital network. And the third pattern, I guess, is a future pattern. That is third-party internet platform pattern. Means that a third-party company in this regard, in this area, offers its internet platform or build up a platform to integrate rehabilitation services, resources from different places and to efficiently match targeted services to patients who make their appointments to ask for help in advance. So I think the third pattern must be the future. I give you some cases. Case 1, a cloud hospital platform in Ningbo city, Zhejiang province. I myself have a work office in Ningbo University in the affiliated hospital for Ningbo University. So I participated in this program. This is a kind of program led by Ningbo City Health Commission and directed by Ningbo Nursing Association, coordinated by the Cloud Hospital Platform. So nurses or rehabilitation related professionals can register in these cloud hospital platforms, then this third party company will restore the professional care provider resources. Then it will be easy for them to match those care provider resources to the needs from patients. So the program's aim is to provide personalized professional health services for elderly or disabled or terminal patients or other residents in need of home care. So users can use this platform to consult doctors, nurses, or other health professionals online and renew a prescription for chronic disease and ask for a medicine delivery to home and make an appointment to go to a clinic, request a medical examination online, clinic, check the report. That's not new because so many same models were already applied in practice. So I'd like to say it's just like we heard about the model of Uber. So if you want taxi, then you ask your request. Then the platform will match your request to the appropriate driver. Then your bus is come, your taxi will come. The same idea. So nurses come from different places can register in this platform, and patients can ask the help, ask their request in this website. Then the requirement from patients will be matched by the third party, by this cloud hospital platform. Then nurses can go nearby, can go to can visit the patients to deliver the service. So far, so this platform has been running since April 2016. So far, more than 3,000 nurses registered and more than 3,000 on-call services have been provided. And the platform can also help realize remote consultation and diagnosis, mutual referral between hospitals, and telemedicine training. I'll give you another case, the Golden Nurse platform. This is a case from Beijing. So they have the same similar operate platform. So patient can make appointment and the platform will access, will do the assessment, then match the appropriate care provider. Yeah, that's some practical model, some pattern of rehabilitation service in future. But the ongoing and in future. What I'm trying to say, the most important key points were you need to provide a precise evaluation and provide a precise intervention. Just like a previous keynote speaker said, we need not only big data, but also smart data. Then we can make a good decision. We can make a good action. So how to collect smart data? How can you say this is a data which will create a good AI, good action? So far, there are 4 sources of voices of data resources to make a decision together. One is physiological laboratories data, so very observed data. very precise data. Another data reported by clinicians related to their professional skill, their knowledge, and the data reported by nurses. And the last one, patient-reported outcomes. So just like what previous speaker said, it's all about us. It's all about human being. We are human beings. So different experience will create different data. We need different data to consider a good AI. So let's talk about what is patient-reported outcome. PRO is a measurement of any aspect of a patient's health status that comes directly from the patient without the interpretation of the patient's responses by a physician or anyone else. Anything they reported will be respected. So if we need to listen to patient reported outcome, listen to their voice, respect to their experience, then a lot of measurement need to be created because physicians are so busy. So they have no enough time to listen to the story of the patients. So if we create a measurement which will catch the important information, then help a good decision making, it will be easy for clinical decision. So a lot of patient-reported outcome measurement were created. Today, I'd like to introduce one of them. I have to say a lot of evidence quality assessment criteria proved that this one, PROMIS one, PROMIS is the best one so far. So what is PROMIS? PROMIS, patient-reported outcome measurement information system. PROMIS was developed by NIH at since 2004. So the research is still did not finish. So it's still ongoing. I don't want to spend more time to introduce PROMIS. If you want to know more about this, here is their website. What I'm trying to say is PROMIS focused on what kind of feeling a person can have. Yeah, physical feeling, mental outcome, and social health. So there are 3 domains. So for nearly 20 years, scientists, nurse, physician, statistics, informatic, IT, so many scientists working together to create this measurement system. So far, they already have adult PROMIS, pediatric PROMIS to assess their feeling. So they contribute one tool to collect data, reflect patient's feeling. So a lot of using type, how to use it, how to integrate PROMIS into informatic technology. That's another story. So far, it already become an international organization, PROMIS Health Organization, and promote the global international usage. I'm very lucky to become the official representative in China. So the launch of PROMIS National Center China was in September 2016. And she is our Vice Chancellor of Medical School in Fudan University. Then I have my multi-sites all over country research team, more than 26 hospitals across country participate in our translation. And so far, our mission is advance the science of health outcome assessment. Working together with other countries to promote, to contribute a good instrument to collect good data to reflect the patient reported outcome. Because we all know patients are the first person to feel the change of the disease. So health management patient is a very strong, very powerful person. We need to let that patient do more for their health management by themselves. So we created a pediatric promise, adult promise to use it to integrate it into health electronic health system to collect the data automatically. And we use it in different disease. And let's return back to the NIMBO program. I mentioned that in NIMBO, we developed an internet rehabilitation service online. So I integrated the promise into this program. Then we can access screening, collect the data, then do a smart diagnosis. We call it assess response model. If the outcome of the decision is low risk, then we give them, we ask them to do the self-management. If medium risk, the professional care providers will in. If patients are at high risk, then we will ask them to come to a hospital. So promise is just an instrument to collect the data. Yeah, we need a lot of data. We hopefully those good data can contribute smart AI to contribute the online this kind of things to help to push the innovation for internet rehabilitation. So how to do it? If we have the instrument, that's not enough. We not only need the instrument, we need to make good use of that data collected by those good instruments. So let's working together to do more innovation in this kind of internet plus rehabilitation models to benefit our patient. Thank you. I'm very happy to answer questions. Thank you.